Forum Civic Buzz. The League is a nonpartisan political organization that encourages informed and active participation in all levels of government. We work to increase understanding of major policy issues and influence public policy through education and advocacy. Our goal for the Civic Buzz is that everyone leaves the discussion with a broader understanding of the issues. Tonight we'll begin with a presentation from our speaker, followed by time for her to address questions from the audience. You can put your questions in the chat and we can pose them to her when the presentation is over if you'd like. Tonight's topic is elder care and specifically healthcare for our aging population. Elder care is a complicated and emotional subject which will test most of our lives, whether ourselves or our loved ones. It can be extremely difficult to navigate the labyrinthian systems for healthcare and payment, all while dealing with the emotional and physical issues that come with needing and providing such care. We'll discuss what resources are available to help us navigate the many transitions people experience between hospital, long-term care, rehab, home care, and more. We'll also consider how the League can advocate, not only for best practices in elder healthcare, for better information for people wrestling with this system. Our speaker tonight is Natasha Merz, Assistant Commissioner of the State of Minnesota Aging and Disabilities Services Administration. Natasha is committed to promoting equity-informed, person-centered practices in Minnesota's long-term care services and support systems, as well as promoting these practices in the workplace. She's excited to continue this collaborative work in her role leading the Aging and Disability Services Administration, or the ADSA. The commissioner began her career as an attorney, practicing elder law and teaching at the University of St. Thomas Legal Services Clinic. She transitioned into a public service career, working for the Office of Ombudsman for Long-Term Care, providing advocacy and dispute resolution services to nursing home residents and people who live in assisted living settings. Following that, she's held policy and leadership roles in the Office of Ombudsman and the Disability Services Division. Most recently, she was director of the Disability Services Division. So without further ado, please welcome Assistant Commissioner Natasha Merz.
Hello, everyone. Good evening. It's wonderful to be here. Thank you for inviting me to come and present and share a little bit about resources relating to transitions from different levels of care in long-term care, as well as talking through maybe some different scenarios and strategies for good transitions when people do need to access higher levels of care and then transition back out of them. So I have a slide deck. It is a very dense slide deck, so I'm not going to go through every single slide, but there's a lot of really good resources on the deck. So I wanted to just kind of give it to all of you and so that you can have it later as a reference point. But you'll see me kind of breeze through a good portion of them because I want to make sure that we have good time for question and answer and discussion. And I know that's really the richness of how we're going to think and learn together tonight. So I'm going to share my screen and be in presentation mode, so I will not be able to see the chat while I'm presenting. So please feel free to put your questions in the chat if that's an easier way for you as we go, but just know I won't be addressing them until I'm done with the slide deck, and then I'll stop sharing and then we can talk through questions in the chat and have a great discussion. So with that, let me share. Perfect. Let me get it into the right mode. Okay, so we're just going to do kind of a high-level overview of aging and services that are available in the aging community, kind of writ large, how we talk about the aging network. So not just Medicaid services, but services that are available under the Older Americans Act and don't require Medicaid eligibility, as well as some other resources for information, counseling, referral, things like that. But kind of this is an agenda that we really look at whenever we're talking about what are we committed to in the Department of Human Services. And it's really making aging and community truly possible for all of us, right? We're all on an aging journey one way or another, and we are going to need supports if we don't already need them today in our community. Make it easier to access services when you need them, support families, friends, and neighbors who are caregiving. We know that the value of uncompensated or informal caregiving in the United States is absolutely tremendous. It's hard to even put a number on it right now, but it is the backbone of our long-term care system. promoting healthy aging across the lifespan, which also, of course, relates to the ability to be in community. When you're healthier, it's easier for you to be in and contribute to communities that matter to you. And also paying attention and strengthening older adult rights, autonomy, and different protections. So those are really sort of our key pillars for how we think about our work in the department. While the department is the Medicaid agency, and we do a lot of work in the Medicaid space, and I'll talk about what kind of Medicaid benefits are available. We also go kind of bigger and broader than that, as I said, to truly try to look at our contribution to the aging network within these 5 buckets or categories. So just a little grounding. I'm sure this information isn't new to any of you, but the total population of Minnesota that's 60 or older is 1.3 million. And roughly 8% of those are people of color. And for the first time, again, you guys probably know this, Minnesota's 65 plus population eclipsed the number of school-aged children. You will hear sometimes that people frame this as something that's somehow negative or somehow a problem, right? The silver tsunami or whatever. I think in the Department of Human Services and in my administration, we are also very committed to spending a positive message that, demographics are demographics. They're neither good nor bad. We really need to be thinking about, as the population demographics shift in our society, or our state tends to be older than it was in the previous 25 years, what do we need to change about our public services and supports? Not just to support people who are aging in community, but to make sure that we have the right services and infrastructure in place so that people can give back into community, right? The idea is that we don't want people having to move into a nursing home or being isolated from their community unless they truly need that level of care. And if they do, is there a way that we can, depending on what the person wants, go for a transitional care unit stay and then transition back to community with some more intensive supports. Of note, Greater Minnesota is collectively older than the Twin Cities. So residents of rural and small town Minnesota are more than twice as likely to be 80 and older than residents in the urban part of the state. And that presents a particular challenge as we think about, what I just said about really making sure we're having structures, supports, and services to have people be included and valued members of their community. Infrastructure in small towns to do that kind of support, transportation hubs, accessible housing, things like that might be more limited. So I think that's something we really need to look at as we think about what's needed to build towards a future with a population that's, net older than it used to be. 1 in 5 adults receive a home and community-based service. So I want to talk about what that particular word means. When we talk about home and community-based services, we're talking about services that are delivered under Medicaid, under the Medicaid waivers and these associated programs. So as you can see, that's a pretty high percentage of people, older adults, that receive some type of a Medicaid waivered service, but there are other types of services out there that don't rely on qualifying or having a means or an asset test to access them. So I think I'm gonna skip through these because these, as I talked about, elderly waiver and alternative care, you can see at the bottom, and the Older Americans Act are 2 different sets of services and support. So the Older Americans Act services that I'll talk through don't require means testing or income testing, right? So you don't have to spend down or be impoverished in order to access the services, but they are very specifically designed to be delivered in community for people that are 60 and older. And they provide services like home delivered meals, falls prevention programs, really grassroots community-based services. And we'll talk in more detail about what that looks like. But those are administered through your area agencies on aging. They get the federal funding to, distribute those programs. They also have volunteer programs. So I think the Older Americans Act funding is really something people may not be fully aware of, and want to make sure that we're really spreading the word so people take advantage of services and really utilize those, especially earlier perhaps in the aging journey when the need for services, the types of services needed might be less intensive than as we age and need more and more healthcare and medical care. So I'm going to skip this one. These are just some statistics about how things break down and how satisfied people are with their services. We utilize this slide deck to present to the Legislative Task Force on Aging. So we really wanted them to see how this breaks out in terms of, are these services helping people? And you can see we get pretty high percentage rates. in terms of services being effective and helping people feel in control of their life, although you see those numbers did dip from kind of overall satisfaction, and get to do things around their house as much as they want to. So again, those are there for you for reference, but I want to kind of move into some of the more meat of what we're here to talk about. So again, this is kind of a visual representation of services that support people that come out of the areas of the department that my team administers. So we talked about those Older Americans Act services that are delivered through the Area Agency on Aging. Sometimes people will refer to those as AAAs. The area agencies on aging get their funding from the MBA, or the Minnesota Board on Aging is what that acronym stands for. So that's the entities designated by the federal government to receive the Older Americans Act funding, and then they distribute that funding to the AAAs so they can deliver services in their communities, in their geographic and regional communities. When we start talking about Medicaid, we move over kind of to the DHS hat. So the Minnesota Board on Aging is a separate entity from the Department of Human Services, but they share administrative resources, and we work in DHS to make sure that the MBA has the support, the personnel, the IT infrastructure, and the functions that it needs. So there is a separation. It's not a particularly important to understand the separation unless you're like deep in the industry, but just wanted to point that out. The MBA also operates with those federal fundings, the senior linkage line and the Ombudsman for Long-Term Care, which is an office that I worked at before this position. And these are two really important free statewide resources. And so we'll spend a fair bit of time talking through what those two entities can do and when you should contact them and access them. But going back to the top of the chart there, you'll see essential community supports, alternative care, elderly waiver, and nursing facilities. So those are sort of in order of intensity of services, with the essential community supports being maybe more intensive or more than the Older Americans Act. But moving up that scale, you'll see that alternative care and elderly waiver are also more intensive services, higher cost, but they do more things, right? You can have more functions, more help, more types of assistance in those programs. And then all the way up to a nursing facility, which is what we would call kind of the highest level of care for our senior population with the most complex needs, other than, of course, a hospital, right? Which we all might access for certain things. So that's kind of think about this as like the intensity of the service, or the ability of that service in terms of its complexity. Lowest complexity starting on the left, lowest intensity, moving up to the most intensive to support people with the most complex needs at the right end of that chart there. So let's talk about Older Americans Act a little bit. So as I talked about before, the Minnesota Board on Aging up at the top of the pyramid there gets their money, gets the Older Americans Act money, which is federal money. And they distribute, so they receive all the federal funding, and then they distribute it per a formula that the feds established to the different area agencies on aging. Those AAAs then have contracts with service providers that the AAAs then will pay for them to provide services that are billable under the Older Americans Act. And so you can see there that some of the things that our AAAs administer are transportation, so one-way trips or two-way trips, home delivered meals, congregate meals, so meals that are delivered in like a senior center or some type of other congregate dining structure. So you could get meals at home, you can go someplace to get meals, falls prevention programs, those free participation for that. And then caregiver respite is another really, really important piece. So that's a very high level summary of some of the most commonly utilized services provided under the Older Americans Act. And again, those services don't have a cost. They're free for people that are 60 and older, and you don't have to do any sort of verification of your income to do that. They're really designed to be easy to access, kind of, again, grassroots, community-based. The idea is that people, kind of the first minute they think they might need some help, or maybe they've had some type of a health incident and they need to kind of up their level of care. These are designed to meet some of those needs and either delay or augment the more intensive services that might be necessary for someone as they, go along their aging journey. So this is just a little chart that talks about Medicaid services. So essential community supports is more of a light touch service. It's for people that don't have a level of don't meet a level of care requirement. And when I talk about level of care, I'm talking about a threshold that the federal government has established to access Medicaid. So to qualify for Medicaid, you have both the income and the assets. Like, are you poor enough to be on Medicaid? And do you have a functional need to be on Medicaid? Do you need Medicaid services and supports? And so level of care is how we determine if the person needs a high level of services and supports. And often the level of care we look at is a nursing home to say, if a person didn't have any supports in the community, no one to help them, nothing, they would otherwise need a nursing home to be safe and healthy. And so the idea with Medicaid is that if you meet that threshold, you can qualify for what we call a waiver, so elderly waiver, and that will pay for services in the community to prevent you from having to go into a nursing home in the long term, if that makes sense. And if you guys want to talk more about Medicaid, I'm absolutely happy to do that. I can do a pretty deep dive into Medicaid. I think some of these other community-based resources might be of more interest to the group, but once we get to Q&A, just let me know. And then in the middle there, you'll see the alternative care program, which is also federally funded, but is really trying to design to kind of meet in the middle between essential community supports and the elderly waiver for people that have more assets and higher income could potentially qualify for the alternative care program. So I've just kind of walked through some of the requirements to qualify for those programs. Again, this is more reference for you all. If you want to go back, I'm not going to read these slides to you, but I kind of talked through that high level summary. Okay, so let's move into how we make services easier to access when people need them. So one of the most important resources that if you take away anything from our discussion today, that you will utilize the senior linkage line at some point in the future. This is a service that is funded through the Minnesota Board on Aging and Older Americans Act. It's operated out of the Department of Human Services, the staff there. It is a free statewide resource for seniors in Minnesota. And we'll talk about in more detail about what they do, but I've linked the web page here, and then this is just a screenshot of their landing page, but we'll get into more detail about the types of services they can provide in subsequent slides. But it's just really important to know it's free. You can call them, you can email them, you can chat with them, you can text. They really are wonderful at customer service and helping you get to the right place. So even if they don't do the thing that you need, they will help you find or connect to the resource that you do need. So think about them as the front door to any and all things, questions about aging. So here's a kind of slide of some of the top reasons that people call us. You can see there are a lot of people that access this service, but we always want to see that number increasing and growing more because we think it's just a really valuable neutral resource for people to just kind of get a lay of the land and understand what their choices and options are, and then maybe go deeper at a subsequent point. So most people call the senior linkage line for general, right? Which is a wide variety of like, I got a question about aging or services and I don't know where to go or what to do. And they, like I said, they will do a warm handoff. They will coordinate. They will get you to the right person. They will make sure that person calls you back. Medicare is a big component of the work that the senior linkage line does. So they do Medicare counseling. As you all probably know, Medicare is a very complex federal program that pays for health insurance for people 65 and older, and those that have been determined to be disabled for up to 2 years previous. But it has Part A, it has Part B, it has Part D. It covers short-term nursing home stays in certain circumstances, and covers otherwise health insurance, sort of typical health insurance. It does not pay for long-term care. That is often a common misunderstanding people have, that Medicare somehow will pay for an extended nursing stay or will pay for people to live in assisted living, and that isn't true. There is a short-term nursing home benefit if you meet certain qualifications within Medicare, but it is time limited, and how much time is limited depends on the condition, and co-pays are assessed sort of after a certain period of time and things like that. But Medicare, as you know, also has a lot of complications in terms of choosing the right plan. There's Medigap policies. There's all kinds of things to think about in terms of picking the right way to access your Medicare benefits. And so a big part of what they do is walk people through that process in their Medicare counseling. So if you have a question about Medicare, call the senior linkage line. I know, something about Medicare, but if I have a question about Medicare, I call the people that work at the senior linkage line and ask them because they're the ones that really know. So again, more resources available or things that the senior linkage line can do. It is both for older Minnesotans and for their caregivers to access those services and supports. So they can help you plan for the future, understand your housing options, and find needed services. And that's their long-term care options counseling. Often we really encourage to have that conversation before they've made permanent plans to move into an assisted living setting. We really hope that people call and explore whether home care combined with maybe an adult day program and caregiver support and respite might meet people's needs. Obviously, people have a choice and they can go live wherever they want to live, but the options counseling really helps you understand that you've exhausted and kind of understand all your different options before you make big life choices about where you want to live and receive services. When people do need to be admitted to a nursing home, there are certain federal requirements called pre-admission screening, and the senior linkage line does those things as well. That tends to happen behind the scenes between whoever is making the referral for the person to go to the nursing home and the nursing home admission staff. So this isn't it's a big part of their work. Sorry about the dog. It's a big part of their work in terms of doing the pre-admission screening, but most members of the public aren't going to necessarily be aware that that's happening. So just wanted to point out it happens, but it's not necessarily something that's going to be the resource for you or anything. But they do have a lot of expertise working with nursing homes, in part because they are the entity that does the pre-admission screening to meet those federal requirements. And the reason those exist is so that the federal government wants to make sure that people with developmental disabilities or serious and persistent mental health issues aren't being admitted to a nursing home without a real need to be in the nursing home, right? So the idea is sure, maybe those folks need to go in for TCU or rehab, but that's not a great long-term place generally for that population to live. And so the feds want to make sure that states are not warehousing people or putting them in an institution for those reasons, and then using nursing home stays for that purpose. For people that are leaving the hospital or leaving a nursing home and want to figure out how to plan to return home, their private pay, there's called the Return to Community program. And this is a really important resource. So I really hope people focus on this as well, whether you're in a hospital or in a nursing home, or a loved one is and you're ready, they want to go home, or at least you want to understand if it's possible to go home. The Return to Community program can help you figure that out and help you arrange that, coordinate with the facility to get the right discharge plan in place if that's the choice people are making. When people are on medical assistance or elderly waiver, the county or the managed care entity is responsible for doing that sort of coordination and planning. But several years ago, we really realized that there's a gap for people that are private pay, right? There's no one you can kind of pay to help you with that. And there's no other way for you to otherwise access the county services and supports. So Return to Community was designed for people that aren't qualified for Medicare, but need help because it's super complicated trying to navigate those discharge plans and figure out what your choices and options are. So Return to Community is a really important program, and it's free. It's designed for people that are not eligible for Medicaid, but you don't need to pay them. It's just a way to sort of make sure we have equal access to that kind of relocation service, coordination service, regardless of payer source or what your income threshold was. And then again, talked a little bit about Medicare. They help people enroll in Medicare, and they help them figure out what right supplemental insurance plan might make sense for them. So that's called the State Health Insurance Counseling Program, or the DHS SHIP. So that's a good resource too. Again, they provide services and supports to help protect people from fraud, waste, and abuse. Prescription drug coverage, service referrals. The senior linkage line, the Senior Linkage Line also operates an online database called minnesotahealth.info. So you'll see that linked below. That's a database of all the aging providers and disability providers as well. They maintain that site, and they'll help people do searches and sort of say, okay, what's home care providers are available within 20 miles of where I live, for example, and help you get connected to that provider. So minnesotahealth.info is also a great resource if you just want to look on your own. You don't need to, it's a public facing, database. So if you want to just go on there and kind of tool around and search and look to see what providers are in your area, that's a really good resource. But they maintain that resource and make sure that it's current and that providers that are in there are functioning, licensed appropriately, all that good stuff. And then finally, they will also help you connect to the Office of Ombudsman for long-term care if you need advocacy services, you're having some type of dispute with your long-term care provider, or you just have questions about how that particular part of the industry works. You can contact the Ombudsman directly as well, but they work very closely with the Ombudsman. And so, if they can refer you over there additionally. So when people do contact the Senior Linkage Line, they have a very good experience based on the satisfaction data that we collect. And so I put that there a little bit. For the it's sort of similar to that bar chart I showed you later, going from this time the most intensive service hospitals is on the left, down to individualized home supports, and again for people with disabilities, employment services, personal care assistance. So the idea here is that there is kind of a continuum of care that people can move through flexibly depending on what they need at one given time, right? So if you go to the hospital or a nursing home, it doesn't mean you have to stay there forever because you're at that level of care. You might have needed it for a while, and then we can work within those resources to do a good discharge plan back to the setting of your choice and make sure that those wraparound services to protect health and safety are available. There's someone to call if something goes wrong, things of that nature. That is enough of me talking at you. So I am gonna stop sharing my screen and open it up for questions and answers or discussion.
Ellen, would you? Oh,
yes,
you do have a raised hand.
Are you ready for questions?
Yeah, Anne, go ahead.
So I have this question about the Medicare. The Senior Linkage Line helps advise about Medicare and supplemental plans.
Yep.
And I'm wondering if that is then the traditional Medicare, well, what we always thought was Medicare, and the supplemental plans, or if that includes Medicare Advantage program plans.
It does. Yep. So I think one of the things they can do is kind of, depending on your situation and what you're looking for, walk you through what it makes sense for you to do Medicare Advantage versus traditional Medicare plus a plan. So yep, absolutely.
Well, I just wanted to make a note that in a sense is very confusing, because Medicare Advantage plans are really private company plans. And so it's sort of like the language has been completely conflated, because my understanding was that a supplemental plan was also different than Medicare Advantage, that you could connect with getting traditional Medicare plus a supplemental plan. But now the language is so conflated, it's very hard for people think they're on Medicare and they're not really. They're hooked up with a private company. So I just wanted to put that out there. I think I think that's a problem.
It's a very complex program. It is confusing. And then you're right that people sort of conflate or pull together. They use different words to mean different things in terms of traditional Medicare fee-for-service versus things that are administered through a health plan, where that health plan gets paid to administer the Medicare benefits and then bills Medicare back. So it is super confusing. I think you're absolutely right. People don't necessarily know what they're using or what their plan means, but the Senior Linkage Line really can help you walk through that and give you like plain language definitions of what these things are, as language tends to shift and morph, and our, health plans are always changing language. So it's a really good point though. Thanks for that. Yeah, Pam.
I saw that Margaret had a comment in the chat, and I'm just going to defer to her first.
Great. Okay, yeah. So Margaret in the chat says, what are the professional services available to help people going from hospital to nursing home or hospital to home? So many times people don't have their prescriptions transferred, their property, etc. Yes, that's a really good question, and that does happen. The quality of discharge planning can be highly variable depending on the individual that is helping you at that time. So I'll start with nursing homes, and the nursing home social worker is responsible for ensuring that there is a good discharge plan that includes medications, referrals to specialists, PTOT, right? Any and all of that stuff. So if those things, and really the best practice, it's not required to have a care conference before, or a discharge planning conference before you go home, but I highly encourage people to, before they or their loved ones or whatever are ready to move home, that you call a care conference, and they should be giving you something in writing that walks you through your discharge plan. And so that gives you or your advocate the opportunity to ask questions. Okay, what pharmacy is my medication being sent to? Are you sending me home with a 3-day supply or a 7-day supply, right? So that you know when and how to make that smooth transition and transfer. And if that isn't happening, and the social worker isn't getting back to you and helping you and engaging with the nursing staff, that's a really good time to call the long-term care ombudsman program. They will come in and make sure that those things happen, or they'll just give the social worker a call and tell, him or her that they need to do better planning. And sometimes they can do that over the phone, but other times they will come in to the facility at the person or the resident's invitation and sit in on a care conference and make sure those things happen. So that's a professional service that's absolutely available in nursing home settings. In the hospital, it's a little more challenging. And I don't profess to be an expert on navigating hospital systems, but I will say that, the discharge planner, the social worker, or the nurse at the hospitals have discharge planning obligations under both their licensure and under Medicare. And so again, the nursing, you should have one go-to person within that hospital system, often the social worker, sometimes the nurse, but more often the social worker, who is walking through and giving you that discharge planning information. If you feel you're being discharged prematurely from the hospital, like you're not ready and they haven't done the planning they need, or your condition or your loved one's condition hasn't improved, you have the right to ask to sort of appeal your discharge and say, I'm being premature discharged from the hospital for the Medicare program. And that is something Ombudsman's office will help you with. So it's certainly a good idea, if you are confused or worried about the discharge plan from the hospital, to consult with the Office of Ombudsman. They don't have funding to do sort of generalized, they generally don't help with like hospital discharge planning on the average, but when the complaint is specific to premature discharge from the hospital related to Medicare, they do have funding and legal authority to come in and advocate under those situations. So it's a great time to call them. Even if they can't come out and open a complaint, they will help you and they will get you to the right resource, and they'll give you information and consultation so that you are equipped to go back and talk to whomever in the hospital to get a discharge plan. Hospitals also have patient advocates. So that's another potential professional resource that if you feel like you or someone you care about isn't being treated fairly and no one's paying attention or following through, that you could go talk to that patient advocate and see if they would be able to help you as well.
Could you talk a little bit about how do you find an ombudsman, or who has it, as opposed to a patient advocate? Who are these people and how are they accessed?
Yep. So patient advocates are employees of the hospital, and they will, and you should just basically have to ask someone at the hospital. I think it's also posted on information that they give you. The Ombudsman's office is an independent state agency. So they are funded through the federal government, but they are independent from DHS, from the Board on Aging, to really truly be that advocate for seniors. So you can contact them. They have a website, and I can provide that to you too. They have a website, they have a 800 call number. So you basically just either call them, contact them, or email them, and someone will get back to you. Senior Linkage Line can also help you get to the appropriate ombudsman. So that's probably the easiest thing, is to call the Senior Linkage Line and say, I want to connect with the ombudsman for long-term care, and they can get you there.
We have another, oh, sorry. I was going to say,
was
we
just
have
gonna
another
say,
question in the chat.
Great. Let me start. I want to get the hands up that are on the screen, and then we'll go to the chat. So I think, Pam, you're first, and between Jane and Ronald, I'm not sure who's next. So I'll let you guys duke it out and decide. But Pam, what did you want to say?
I just, well, thanks for doing this, Natasha. We really appreciate it. But I just wanted to have you maybe talk a little bit about some of the big issues that the state is facing around caregiver shortages, and people being backed up in hospitals during certain times when we've had a lot of COVID cases and things like that. But the shortage of staff in the community and in facilities, leading to closures of nursing homes and assisted livings even too. And just wondered, just in general, what you're seeing there, and like what can be done, or what should we be trying to help with in terms of messaging around that?
Yeah, great question. So I think when we talk about nursing home closures, I think what I want people to recognize is that over time in Minnesota, nursing homes open, nursing homes close. Nursing homes don't all open. We have a moratorium on new nursing home beds. So there has to be some type of exception to even get a new licensed bed. And so part of that rationale is that policy of, we really do want people that are aging to be aging in their communities. That's where we get, it's financially much more affordable, health outcomes are better, satisfaction for people that is better. Doesn't mean of course people can choose to go live in a nursing home. That's 100% their choice. But what we're trying to incentivize from a public policy perspective is that aging in place and staying in community for as long as that's possible for people. So I know that the nursing home industry has been really vocal about how difficult it was during COVID, and that's of course totally true. Just like it's true for assisted living, just like it's true for services for people with disabilities. But I will say that as we track nursing home closures over time, we are not seeing a significant voluntary closure rate. It's possible that will happen in the future, but we have a very healthy value reimbursement system for nursing facilities in Minnesota, where they are reimbursed for all their costs in a system called value-based reimbursement. So I think sometimes people get really nervous and sort of feel like our whole system is going to collapse, and that is not what we're seeing or concerned about. However, that does not mean that the staffing shortages across our long-term care system isn't a crisis and a significant issue. It really is. Part of it is the demographic shifts that we talked about. There simply are not as many young people in the workforce as there were before. And a lot of people that were in that long-term care workforce left during COVID. And then anytime we see low unemployment, and that depends on the health of the economy overall, but anytime that we see low unemployment, we do see that access to care and services is curtailed, because people that could be they can make the equivalent amount of money working perhaps in a nursing home or an assisted living as they could in a retail setting or a restaurant or things like that. So we're competing with those employers in the marketplace. Thinking about what can be done. So one of the most important things is to advocate with your legislators to make sure that we have sustainable rates for our home and community-based services and supports. My sense is that we don't pay enough attention to those core services that are delivered in community. So one is to advocate for Medicaid rates, because we need those in order for people to access elderly waiver, or if they do spend down. But the art part is really supporting efforts that promote community health, access to services, augment services the AAAs provide with federal funding, helping maintain grant and, advocating for grants and things like that. So I think really advocating for additional investment in the community and community-based services is the most effective thing that we can do to address the problem that Pam talked through. I will also note that in Minnesota, we have what's called an age-friendly council, which is a multi-sector plan on aging. So this is a governor-appointed and governor decreed council that really works across state agencies and with communities to make their communities more age-friendly and help people age in place. And this is they have temporary funding right now. So they were established in the some of the additional federal dollars coming in while we had the public health emergency. And they have done really, really amazing work getting a multi-sector plan on aging, getting a coalition built. And so one thing that I think personally would be very helpful would be for legislative support to fund them permanently and establish them. Because right now they're kind of going year to year on temporary funding. But I really look at that as the place where a lot of our efforts across Minnesota can be organized and aligned to create those more age-friendly communities and talk about, not just funding services and supports that are particular to older adults, but things like affordable, accessible transportation, which everyone needs or will need. People with disabilities need it, older adults need it. Affordable, accessible housing are things that people need, insurance programs that are affordable and things like that. So I really like to think about preparing and providing services to elders in our community as being everyone's responsibility, state agencies, communities, counties. And I look at age-friendly Minnesota as sort of, again, that bucket, that container that can really organize and align efforts and work with local communities. So,
what did you call the commission, or it's not a commission or committee that's about the age-friendly?
Yeah, it's actually called Age-Friendly Minnesota. And let me, I will pop their information into the chat.
There's a person in Minneapolis that works for the city that's like a leader, or supposed to be the staff person assigned to this. I was going to meet with her recently and I had to cancel, so I'm going to try to get that rescheduled. But I'm curious as to what the city of Minneapolis is doing to connect with Age-Friendly Minnesota.
Yeah, great question. I just put a link in the chat there to their website, so check it out. Jane, you have had your hand up for a while.
Yeah, thank you. I've got two questions. With the Older Americans Act being a federal act, first of all, how similar or different are the services across the United States, state to state, and how does Minnesota compare? I mean, I don't know if that's a fair question to even ask you, but how consistent are they? And then my second question is, does your organization actually monitor the quality of the services and care? Because you see from time to time all these exposés about, nursing home care or some of these facilities, and who is responsible for the quality monitoring?
Yeah, excellent questions. I can talk about both of those. So your first, do other states, how do other states use their Older Americans Act fund? Do they tend to provide sort of similar services, and how does Minnesota compare? So generally you will see similar service buckets in other states with Older Americans Act funds, because they fund, in the regulations, specific functions. So they have senior nutrition programs, falls prevention programs, dementia education programs, congregate meals. So those programs are defined by the federal government, and the funding is specific to those defined programs. So again, you'll see variability, you'll see consistent sort of service definitions probably in other states. How well the infrastructure is established and how kind of good the service is variable across states. So one of the things that I know from, going to national conferences and things is that in other states, their senior linkage line equivalent, it's called an information and referral service. That's like the federal name, and then Minnesota named it the senior linkage line, are much less resourced, not as well built out, not as well staffed, don't necessarily have the same training and expertise. Obviously that's super general, but like other states are often really talking to Carrie Benson, the director of the Board on Aging, about how she's able to, administer and have a high quality service with the fairly limited administrative funding that supports that function. Part of why we can do that is because they're housed administratively within DHS, so they can leverage some of the infrastructure and sort of muscle of a big state Medicaid agency, whereas in other states those functions might be completely separate and it's just a little agency. Older Americans Act funding is not enough, and the funding to administer the programs is ridiculously small. So often, I know there might be a public narrative of like, we don't need to pay people like states or bureaucrats to administer programs. But when you skimp on the administrative funding, it means that program that people use is going to be less effective overall. And so obviously you don't want so much administrative funding that you take away from the services, but being able to fund the administration and the operation of these programs it has a direct impact on the quality of the experience of the person that uses it. We'll say that Minnesota was recently named the #1 state of all states in long-term care services and supports on the LTSS scorecard. And I can throw a link to the chat in there too. That is established by, yes, here, Pam. Minnesota always ranks high. We were not #1 3 years ago, which, was sad for us, but we were happy to be #1 again. And that really is a testament, not just to the work that my team in my area does, but to the whole aging network and infrastructure. Our contracted providers under the Older Americans Act, our long-term care service providers, the level of investment that the legislature has put in to our services and programs, and of course, our AAAs and the work that they do and the way that they've built coalitions and done really innovative things in their community through grant funding and other things like that. So Minnesota does very well in terms of its comparison to other states for services and supports. And I'll say that's not just for seniors, it's also for people with disabilities. But even as a top performing state, of course, our system has gaps, has weaknesses. Bad things happen in long-term care settings, just like anywhere else. So I'm not, here to tell you that like, because we got #1 on the scorecard, that everyone's going to have a great experience in our long-term care system, because it just doesn't work that way, right? Life is more complicated than that. So that brings us to your second question about the quality of care and who oversees that and how does that function. So the first way to sort of answer that question with the question is that service licensed? Because that's going to dictate who does the quality assurance. So mostly as we think about that service continuum, the more intensive services, like services delivered under elderly waiver, services in a nursing home, services in an assisted living, are going to have a license that is going to have a state agency that is responsible for ensuring appropriate quality standards to meet. Licensing is the floor, right? Not the ceiling. Licensing is the minimum standard. So in the case of nursing homes, for example, the Department of Health is the regulator of nursing facilities in Minnesota, regardless of whether it's Medicare paying for it, for that limited stay, private pay, public pay. That's going to be the Department of Health. They're also going to be the regulatory entity for assisted living licensure. And Minnesota, I was actually really far behind other states in which we didn't have an assisted living licensure up until 2019. We had a housing with services registration and a home care license, which was not a sufficient level of consumer protection for people that needed assisted living. So I'm very glad we have assisted living licensure now. And the Department of Health oversees that component in terms of the regulation. Thinking about quality, right? That regulation or licensing is the floor, but trying to measure quality, my area does some of that work in very close partnership with the Department of Health. So we operate out of my area what's called a nursing facility report card that kind of takes all the different regulatory information from public surveys, staffing patterns, things like that, and moves all of that and tries to consolidate that information into a scorecard for a particular nursing home. So if you're trying to assess between 2 or 3 different nursing homes and understand what might be the better choice, definitely look at the nursing facility, the nursing home report card, and I can put that in the chat in just a minute. You can also Google it, but that's for nursing homes, that's a really good way to do that. I will say if you can contact the Ombudsman's office if you have a question about a nursing home, They can sometimes give you a good indication of what might be the right fit depending on what your needs are. So that's more of a, more of an anecdotal or advocacy way to think about quality. We are close to launching an assisted living report card. It's not published yet. I want to say December is what we're targeting, but I would need to double check with my team. That has taken us a really long time working with the assisted living industry to come up with measures that feed the report card that are reliable and that the industry believes is a fair measure of quality. And of course, there's always push-pull between that. So it's taken us a long time to kind of negotiate and get to agreement on that, but that is forthcoming. Let me move over to the chat to make sure we don't miss those. Question from Deborah: can the Ombudsman's Office advise on financial responsibilities of patients and family members? If not, who is the expert on that? Yeah, so you'll see Pam knows a lot about this. And Minnesota Elder Justice Center is a great resource. The Ombudsman can give you a high-level lay of the land. They are not going to give you legal advice, and often, depending on your situation, it is worth talking to an elder law attorney just to understand, particularly if you're private pay, you have some resources. There are different ways through consulting with an elder law that you can figure out how to be the most strategic with your assets and not, try to figure out what your plan should be, what you shouldn't be financially responsible for. But Pam is absolutely right. Family members are not generally responsible for their family members' long-term care costs. Sometimes facilities will ask you to voluntarily become responsible, and that is where you want to either talk to an attorney or talk to the Ombudsman before you sign anything to understand what you're signing and what it might mean in terms of adding a legal responsibility that you don't otherwise have. Anything you would add? Oh, okay. Question from Meg: if you are moving a family member from another state to Minnesota, is there a process they have to go through to access those services? Is there a waiting period before they are eligible? Great question, Meg. So if we're talking about Medicaid, so elderly waiver, essential community supports, alternative care program, there is a process that's called a Min Choices assessment. That is a comprehensive assessment for services and supports that anyone can request. By the way, you don't have to be moving in from another state. You can request that assessment at any time from your county and have them come out and say, okay, you might be eligible for this. Min Choices will not do your financial eligibility, but that person will help you get to the county to establish that. They can also help and just do some initial counseling in terms of what are your services and support needs? What are your different options? Counties are very, very busy right now with Medicaid renewals and do get backlogged on Min Choices. So I'm not here to tell you that you call and they'll be out the next day. But the way that we've designed it in the state is to be more of a accessible service for people to have someone come into their home, talk through it with them, and determine if they're eligible for services and supports and help them access it. But it is, counties are having the same workforce challenges that our long-term care providers are. So it's a resource. It may not, I just want to put kind of that grain of salt in it. Whereas like the senior linkage line is set up to take calls, to answer calls, to do it quickly. That's their job. Counties have huge jobs in Minnesota, and different counties have different levels of sort of investment and impact in terms of how much they can help at the initial phase. So there generally is not a waiting process, although you do need to be a resident of Minnesota or like live in Minnesota to access those services. For Older Americans Act, there's no waiting. I don't think they check your residency requirements. You just need to access and get attached to the service. But for Medicaid, you need to establish that you live in Minnesota. And that's where you intend to stay versus you're just coming for a visit. From Rosemary in the chat: does long-term care determine if they pay only for facilities as opposed to care in home? Rosemary, can you clarify, do you mean long-term care insurance? And Rosalie, if you might be muted if you're trying to talk.
Yeah, I sorry about that. Yeah, long-term care insurance seems to have a lot of variations from policy to policy. How does that impact people that have needs, and who who deals with that or who monitors that within a state?
Yeah, so in most states, but I guess I don't know about most states, but in Minnesota, the Department of Commerce monitors all insurance policies, including long-term care insurance. As you've identified, they are really all over the map, and in terms of what they cover and what their coverage limitations are. So it's hard to make a general statement other than, read your policy and see what it says. One thing I want to flag in the long-term care insurance field is we are working on a project that we call Own Your Future, where we're trying to figure out how to create a long-term care insurance products that somehow kind of backed by Medicaid so that we can create more affordable public-private options. So you all may have had the experience or know people that tried to get long-term care insurance, and it is, unless you get it when you're 20 and healthy, and no one does, it's very, very expensive and complicated to utilize. So we are exploring different ways to try to maybe bridge the gap between someone who can afford a very healthy, big long-term care insurance policy and someone going down to Medicaid. We're trying to find a middle option where maybe if we can have Medicaid somehow pick up some of the more catastrophic or long-term costs, then that might incentivize the private insurance market to hold their premiums lower and make that a more sustainable long-term benefit. So it's very much in the study phase, but we are really hoping to come back in the 2025 session with some type of a proposal to either start funding some type of a program like that, or, kind of depends how far we get and how much support we get from stakeholders to move quickly on that. But just wanted to flag that we're considering how we might be able to somehow leverage some of the Medicaid program to make private long-term care insurance more affordable. Yeah, Pam.
I just wanted to say, for anybody who does have a long-term care insurance product, as I did and my husband did, the fine print is the problem, and it comes in how they assess you. And the assessment, my husband couldn't speak. He couldn't get his own food. But he could walk and he could go to the bathroom, and he wasn't eligible for anything. We finally got him eligible for music therapy. That was the only thing we got out of the long-term care insurance, which they had never done before. And it was kind of hilarious because they did that, but they wouldn't do anything else basic. And he was, judged to not qualify for any of it at finally, just before he died, even though he had all those disabilities. So the way the assessment forms are written and what they mean by when someone's dependent or not dependent is extremely important. And, quiz your, whoever your insurer is very carefully about that before you even think about buying an insurance policy. Or even when you have one, find out what it really means.
Natasha, there was, I think, one up in the chat that we may have skipped from Meg. Does the Senior Link support system also help disabled adults who are under 65 but who are already on Medicare?
Yeah, so the short answer is yes. They may refer you to their, their sister program called the Disability Hub. That also same thing. It's the same type of it's the same type of concept. It's an information and referral service. They get federal funding as well from different federal sources. So behind the scenes, the Disability Hub team and the Senior Linkage Line team work very closely together at cross referrals, kind of having their two platforms work together and having information be consistent. The Disability Hub is more focused on younger folks with disabilities. So I think someone that's under 65, has some type of disability or is aging could kind of fall into both categories. But the point is that it doesn't matter. Call one of them, and depending on your question and what the issue is that you're looking for help with, they're going to get you to the right place, right? Like if you're looking for Medicare counseling, the Disability Hub is going to send you to the Senior Linkage Line, regardless of what age you are. Whereas if you're looking for options to self-direct your services and hire and fire your own staff and be on the waiver, they're probably going to send you to the hub. So either door is an appropriate front door.
Okay, and I'm going to say that we are at 7:59. So I see Deb has a question, but that may have to be our last one.
I put it also in the chat, but I just wanted to emphasize if there's some way of letting people know how difficult it is to access long-term care insurance. I had a relative and it was got to be almost a full-time job trying to get that payment for a person who couldn't do it himself anymore and whose wife had died. And it is so frustrating. And we finally were able to get him a little bit of money, which came 3 days after he died. So it's, if people think long-term care insurance is a good thing, I think the state and media needs to get this word out there that it's not a magic bullet.
Yeah, no, it's not. And the current way the market is and the fine print and the qualifications, it is a full-time job. I mean, my father-in-law, we went through the same situation with his policy, and like my husband and I are both lawyers, and we both had to like put our heads together and like write letters to the company. And the first nursing assessment we got, they said he didn't have any dependencies, and like he had a lot of dependencies, right? So I think that's, and one thing to consider too is if that's something you all wanted to sort of take on as an issue, that requires a level of expertise that most people in the aging network don't have, because insurance is its own industry. And so it might be that there are good reasons to create some dedicated resources and expertise for free to help people navigate those things. Like, obviously I'm biased, but I feel like if the Ombudsman's office got some money to do that and hire some insurance experts to advocate just in that zone, that could be a really effective interim step where we're trying to develop insurance products that are easier to navigate in the market. I also think as we in the department think about own your future and what that looks like, I think one thing that this is helping me think through is like, insurance is complicated, but if we want this to be an effective program, we have to make it as simple as possible for people to use and navigate. Like we have to prioritize simplicity over complexity. And sometimes what that means is it costs a little bit more. Because sometimes the complexity comes in where like you can keep your premium low if you make people go through 15 different channels to get access to service and jump through 1,000 hoops. Most people give up before they get there, and that means that they don't have to pay as much out. It means their premiums stay lower. So I appreciate that feedback too, and it's kind of prompting thinking on how we might position a product in the future that we have to build up our own expertise in this area because we don't come as insurance experts. But I think that's a really good point.
So I'm going to take the privilege as host of asking the last question. And basically, I just wanted to go back around to what do you think in this space where you have the expertise would be a good use of our advocacy time and efforts to help people navigate the system, or to help people get the information they need about the system, or to make that information more transparent?
Yeah, I mean, I think one of the questions is how can we get the word out about Senior Linkage Line and Age Friendly Minnesota? I think those are two such important resources to elevate and amplify that. Talked a little bit about really advocating for community-based resources to build out things that everyone needs to be a part of the aging community in terms of that infrastructure, affordable housing, affordable and accessible transportation are things I would really highlight. And then the last thing, I think there is something too about working to elevate the importance of caregiving, both paid caregiving and informal caregiving. Sometimes I think informal caregivers feel invisible. They feel like they're isolated and alone, and no one, recognizes the very significant contribution they're making, not just to their loved one's life, but to society. And like, how can we do public information campaigns or shout outs to really elevate that? And then similarly for our direct support professionals that work in the Medicaid program, that work at the AAAs, that deliver those services, how do we really lift that up as really, really valuable public service and not and pay them for that and really value that? So I think there's also something about how do we shift the way society's thinking? And I look at, organizations like yours that, aren't just Medicaid, aren't just a very, one particular niche issue, but like, if you wanted to get into this space, those are the types of things that I think could have a huge impact in the long term positively. And, there are a million ways that you could support. And legislation and, things like that. And so if you ever wanted to get together and connect about what's on our legislative agenda at the department after the governor's budget is released, and what does it mean, and how can you support, or how can you, if you're concerned, we certainly want to hear that too. We also, it's important to note, can provide you with technical assistance on the legislative process. So let's say, for example, you wanted to bring a bill to do I'm just making something up, a public interest campaign about the importance of informal caregiving, and you wanted money to do it, you wanted funding, and you wanted the platform. We could, help you figure out how to write that language, how to do a fiscal note on it, so that you could take something, to your legislator or your committee chair and say, we want you to introduce this bill. And the department, and we could say, this is how you could make it work. Or sometimes people have ideas that are impossible to implement, and we'll tell you that and say, well, here's another way you could make it work. So that technical assistance function in legislation, I will say that we have an amazing legislative team that can help you with that. And so if you wanted to, engage in that process, either this session or a future one, connect with me, and basically all you have to do is say, we want technical assistance from the department, and then we'll help you, because that's a big part of our responsibility as a public state agency.
It's great. I had no idea. Okay, we're gonna have to wrap it up. We're over time. Thank you so much. Thank you to our speaker, Natasha Merz, State of Minnesota Assistant Commissioner for Aging and Disability Services. Everyone's giving you a round of applause.
Thank you very much. Thanks for having me here on these really important topics. Obviously, I'm quite passionate about them. It's my life's work, but I appreciate your interest, and let me know if there are additional resources and information you can provide. Have a great night.
Great. Thank you.
Thank
And
you so much,
everybody. It's
Natasha.
been a great questions, great audience. I hope we've met our goal for the Civic Buzz, and we're all leaving with a broader understanding of this issue. And the recording will be available on our website in a few days, and also Natasha Merz's slide deck. Her presentation will be available for download as well. Thank you.
Thank you, Lisa.